is nice to have a large crowd, because what that says to us is how important this hospital is to the community, and that's exactly what we need. We need folks to be committed to North Central Bronx Hospital. We wanted to provide just an update. Some of you may have picked up on the table when you were signing in a timeline. We had target timeline dates. I hope all of you were able to get that. If not, I do have some extra copies of that. But it's important that we share what our work plan is to get from where we are today to what we all in this room want, is the consumption of services for maternity services here at NCB. I want to introduce my colleagues, because I'm not going to do a lot of the talking, they will, because they're the ones who run this hospital and these services. Mr. Bill Walsh is our Senior Vice President for our network, the North Bronx Healthcare Network, and that includes North Central Bronx and Jacoby. Dr. Zinnemann is our new chair of the OB services, and he's probably the most important guy at this table. And Sheldon McLeod is our administrator for North Central Bronx. So I think what we should do is start off with basically what the good news is. And I'd like to introduce Bill so he can provide a bit of an overview. And then Dr. Zimmerman can talk about what the really incredibly important things that he's already begun to undertake in terms of bringing together a really good team, but also what the staffing pattern will be, and the other services that we will be providing, and in terms of our goal for the return of quality and safe maternity services here at this hospital. Bill.
Thank you, LaRay. Good evening. So just to recap, you all know that back in August we made a decision to temporarily close the maternity service. And we did it because we could not guarantee that we could safely deliver babies in two places, that is Jacoby and NCB. And people may think that there are other reasons, but those are the reasons. And quite honestly, if we had to do it again, that's the way we would do it, because the last thing we want to do is to put people's lives in jeopardy, particularly people who come here for what should be a happy thing, a beautiful thing. And I can honestly tell you that the thing that sort of tipped the scale and made it more and more difficult for us to deliver babies in two places was the fact that Montefiore Medical Center pulled the residents out of Jacoby after many, many years, decades of Jacoby having a service with residents. And unfortunately, there was a great deal of turnover after that. But we've been working for many months behind the scenes to do what we needed to do to position ourselves to be able to reopen. Back in November, I publicly announced that we were going to reopen. And just this past week, we had a press conference here, and Councilman King was able to be a part of that, along with Congressman Charles Rangel. And we again announced, first of all, that the State Department of Health had given us some time to be able to safely rebuild and open the service. Thank you, Councilor. And we announced the time frame of by the end of next summer.
This summer.
This summer. Well, it's the next one. It's the next one. We also secured the approval of the leadership of the New York City Health and Hospitals Corporation to make a significant financial contribution to this hospital on an ongoing basis. And in addition, we're going to be receiving resources that will help us strengthen the services at Jacoby as well. So that's where we are. It's going to take a lot of work over the coming months to recruit staff and make some of the physical plant renovations that need to happen. But we at this table are committed to make it happen, and my sense is that you are as well. And now I'd like to introduce Dr. Michael Zinnemann. Dr. Zinnemann is a big part of this rebuilding process. We really could not go forward until we had new leadership in the department. Mike joined us in the middle of December, has already recruited a handful or so of new physicians, has been working with his team, this, and they've been putting the plans together to sort of reconfigure and get back to where we were, if not get better here at NCB and do the same at Jacoby. Mike?